I am Dr. Senthil. I'm the pediatric intensivist from Meenakshi Mission Hospital. The overview of my talk will be to answer certain questions which will be running in our mind to doctors as well as to common people. Like, is the third wave inevitable? Whether we can avoid the third wave, or if it is not possible, how severe will it be? Will it be like the second wave, or will it be in a milder form? And are children at highest risk of COVID in third wave when compared to adults? Which the hype is the hype which is being given regarding the children and COVID. And if at all children are affected in the third wave, how severe the infection would be, whether it will be severe or mild. And we often talk about the COVID disease in children, but there are certain things which happen as a side effect of this COVID wave. We'll try to see what are other issues the children face apart from those COVID infection, and will vaccine be available, and regarding the school reopening, whether it is a fairly reasonable idea or are we jumping the line to start the schools. Will we ever have a third wave? I think Dr. Anup has already answered the question. The answer is yes. Even I too agree with Dr. Anup regarding the possibility of a third wave. It is definitely possible given the circumstances, because there are susceptible population who are unexposed either to the vaccine or to the viruses. Dr. Anup has given 4 reasons why this third wave is possible. And all these waves after waves are possible till we achieve a herd immunity, which is the maybe the definite way to prevent these waves, and which will in a way slowly wean off to a situation of endemic where there will be few cases then and there, and that may take a long time, as Dr. Anup has mentioned. And to achieve this herd immunity, there are 2 possible ways. One is natural infection and the other one is vaccine. The natural infection may be a quick way, but the price we have to pay for that will be huge by way of mortality and morbidity. So the best way would be to achieve the herd immunity by means of vaccination. Previously, during the first wave, they predicted to achieve a herd immunity, we need around 70% of the population to be either vaccinated or exposed. And after the second wave, because of Delta variant, now this has been increased, pushed to around 90% of the population needs to be either vaccinated or exposed in order to achieve a herd immunity. The next important question regarding the third wave is whether this wave will be hitting us like a tsunami, or will be like a wave, just a wave, or will it be like a ripple effect? To answer this question, we have to look at 2 data. One is the historical data, and 2 is the data available in the last 2 years. Historical data by means of the Spanish flu, which hit the world during 1918 to 1919. The graph at the side shows the peaks, the first, the second, and the third peak, where it is clearly visible that the third peak is usually a milder one. And the epidemiologists are predicting the third wave of corona, of the COVID, to be as mild as that of the Spanish flu, or to behave in a similar pattern. The reason is, it has been found that the population has been exposed. Around 2/3 of the population has been already exposed in these first and second waves. So the third wave predictably can be milder, or at least not as severe as the second wave. But there is one caveat or a break here, because all these things, all these predictions, assumptions are only based on the data which is available. But these variants and these viruses are highly unpredictable in their transmissibility, or the way they spread, the way they affect, the way they infect, the severity scores, and the way they bring about the breakthrough infections. So there is always an uncertainty which is prevalent during this, with this corona wave. So even having said that the third wave may be mild, mostly it might be mild, but it all depends upon the future variant and the mutations. This slide clearly shows the corona wave, the first wave and the delta variant, where they stand as of now. The delta variant, when compared with the first wave variant, that is the alpha variant, has been found to be highly transmissible, but the severity is almost as equal to that of the alpha variant. That's why the second wave in India was like a tsunami, which involved huge number of persons at any given point of time. So from this slide, when we extrapolate to a third wave, we expect the third wave to be a bit mild. The next important question which arises is, are children at increased risk during the third wave? Why did this question arise at the first? Because a lot of hype has been given and a lot of superficial data has been analyzed, which resulted in this question being given so much of hype. Like the initial analysis showed the first wave, the older population were found to be more vulnerable and they were severely affected. And the second wave, the vulnerable group were found to be the middle-aged group, where the coronavirus was so predominantly affecting the middle-aged group, as the older group were either previously exposed or have been vaccinated. So logically, they expect the third wave to infect the children predominantly. The reason being the older groups and the middle age have already been infected with the viruses. So the leftover group, the left alone group would be the children. So the logical expectation was the children might be more affected. But that may not be so. This slide shows the various medias which are given conflicting reports about the expectations expectations regarding the third wave and how bad the children might be affected. So this shows anywhere between the third wave being a silent spectator to the third wave being extremely dangerous. So this is the wide coverage which is being given in the media. Conflicting reports and unscientific data is being thrown at us, which makes it more complicated. So is it true that children are at highest risk when compared to adults? There are two schools of thought who approach in a different way. And these schools of thought are by experts. They are not lay persons. They are experts in their respective fields who have two different ideas. And these ideas are exactly opposite in their predictions. And these are exactly opposite because there is a lot of uncertainties regarding the data and the viruses. The virus is highly unpredictable. The mutations are unpredictable. We don't know what we have in the future. And all these assumptions and predictions are based on our past experiences. We don't know what we have in future. And the data available is very scarce. And it is highly variable from region to region. And even within the country, it is highly variable between south, north, east, and west. And the data available, we don't know how quality the data is. So a lot of lacunae are there. So the predictions are between black and white. They're very extreme. And there are a lot of confusion regarding these predictions. So with these predictions, with these expert predictions, the government can only make a policy where it is always better to be safe than sorry. That's why the government wanted all the healthcare sector to be prepared for the worst scenario where the children might be affected. But still, we hope for the best. The group which says the children are at highest risk, the points they favor is, one is the non-vaccination. Children, as we know, there is no vaccine available as of now. So that is at a disadvantage for that age group, because we know that vaccine definitely has a role in prevention and also a very significant role in decreasing the severity or the morbidity. So as of now, we don't have vaccine. So that is a definite disadvantage for this age group. The second point they say they have for highest risk group is the unexposed population. Their argument is the children population is being unexposed both in the first as well as the second wave. But it's not so. The past experience have shown that the first wave, the incidence was high in the older age group. The second wave, more of the middle age group has been involved. So they propose that in the third wave, the children might be highly infected. And these infections might be severe in children. And the most important proposal they have is they are worried about the inadequate infrastructure if at all a third wave happens. If it is severe in children, the allotment of pediatric facilities, pediatric COVID care is, as of now, is not very robust. The number of beds or the personnel or the infrastructure, the ICU beds, all these things are not up to the mark to manage a high severe or a high caseload from the pediatric side. So these are the justification they put forward for justifying that pediatric cases will be more during third wave. But what about the other side of the coin? There is a group which says that the pediatrics are not at higher risk as expected, because again, even though the vaccines are not readily available right now, in future it's almost at the doorstep. By next month, we will have the first vaccine for pediatrics in India, and by October the second vaccine might be ready. So children might get vaccination. At the same time, the adult vaccination, if it is done aggressively, it will act as a shielding mechanism, and thereby it will prevent the children from getting infected. The second point they propose is regarding the exposure. It has been said that the children are unexposed in the first and second wave, but recent seroprevalence data is showing otherwise. It has been shown that the children are exposed as equal to adults, both in the first and second waves. The seroprevalence data has shown that nearly 55% of children are exposed to infection, and this being the natural infection alone when compared to 66% in adult population. So this shows that the pediatric population has already been exposed unknowingly to the infection, but they have not been admitted because the infection in pediatric population are always or are mostly mild to moderate or asymptomatic. So a lot of children were asymptomatic or very mild, that they were unaware that they had acquired the infection. So with these data in their armory, they argue that children need not be the vulnerable group, because the coronavirus has infected all the age groups equally. It didn't infect the adult or the older people in the first wave, the middle age in the second wave, and it will not infect the third group, that is the pediatrics, in the third wave. So the spread or the infectivity of the coronavirus is equal. It has infected all the age group equally. But what happened is, the children were mostly asymptomatic, that they didn't show the symptoms, or even though there were symptoms, they were very mild to get hospitalized. So the data has shown that both in the first wave as well as the second wave, nearly 12% of these confirmed cases were of children less than 20 years of age, and the seroprevalence was same as adults. And the most important thing is, even though the children have been infected, their severity has been very minimal. Mostly they were asymptomatic. Only 2 to 3% of positive children had needed hospitalization. And among them, the children who need intensive care were very, very less. And the mortality is negligible. So coming again, so this group has proposed that even though there is no vaccine available, even though the third wave will involve children, it will be as equal as adults, and children will not be at any higher risk. So there is no need to worry about this aspect of children getting more infected. Regarding the health infrastructure, during the second wave, at a peak time, we had nearly 4 lakh cases per day. So that was the reported data of peak in India. So even during those peak situations, the pediatric infrastructure were not stretched beyond its capacity. The pediatric cases didn't rise exponentially. We being pediatric intensivists and pediatricians, we never had such a situation where we couldn't accommodate the pediatric population. So we never had such a high caseload, and even those children who got admitted had very minimal or mild disease. So even at the peak of infection, the infrastructure was not stretched beyond the capacity. So the third wave, which we expect to be milder than the second wave, will not stretch our limits to the maximum. So as pediatricians and pediatric intensivists, we are very confident that the infrastructure we have is more than enough to handle any kind of situations, even if the third wave is going to predominantly affect the children. So the government has formulated an situation like government has formulated that keeping in mind the data which showed 2 to 3% of children will need hospitalization. So government has proposed all the pediatric setup to be ready to face an eventual situation, even if the percentage of admission is doubled. Means we are right now ready to handle situation even if the pediatric infection or the rate of admission is even at double rate, that is from 2 to even up to 6%. So that is the proposal by the government to the pediatric facilities to be prepared to face any eventual crisis. So this is the zero prevalence data which you have been talking about, which has given a positive idea about the third wave and the pediatric infection. This is the fourth zero survey done by ICMR, which showed the adult 67%, that is 2/3 of adults have already been exposed to infection, and pediatrics, that is more than 6 years of age, the zero prevalence rate is around 56%. So previously, the group which we thought was non-vaccinated and unexposed, now we know that they have been already exposed, and this exposure is as equal to that of the adults. Somehow they have been exposed, but they have not been symptomatic. So they have been exposed and asymptomatic, and even in symptomatic cases, the severity was very mild. So the remaining vulnerable pediatric population is same as that of adults. So putting in nutshell, the arguments on both sides who argue for high risk versus the low risk, we'll see point by point. The high risk group, they propose that children were spared in the first and second waves, and so they will be very vulnerable in the third wave. But data has shown otherwise, that children are equally exposed in both the waves. And children have no vaccine, so they're highly vulnerable. And here, the adults, if adequately vaccinated, they can even shield the children. We also agree that this point, non-vaccination is at a disadvantage for the pediatric age group. But still, the third point they propose is, if at all the third wave infects children, it might be severe. But data have shown that infections in pediatrics historically have been very mild. In fact, have been more of asymptomatic infection, or at the most likely to be like an URI. And the last point is regarding the healthcare. They expect the healthcare will be overwhelmed in dealing with the pediatric population. But data has shown that very few percentage of children will require hospitalization, and that too very few children might require ICU care. Having said that, the government has issued guidelines as to how to be prepared to face the eventuality, and by now almost all the pediatric hospitals are already ready to face. They have been equipped with all the necessary precautions, beds and the ICU infrastructure. So ultimately, regarding the third wave, who are at highest risk? The incidence is going to be more in adults, severity is going to be more in adults, hospitalization again is going to be more in adults. So this clearly shows that third wave, again, the adults are at the highest risk when compared to children. So children, even though we think they are the vulnerable group, actually adults are still being the vulnerable group. And all these have been the experience of the historical data and the data available in the last 2 years. But still, this being a new virus, which is unpredictable, we don't know what we have in store in future. We always have to take all this data with a pinch of salt. That is, we know that we are not going to stare at a catastrophe, but we are definitely prepared to deal with any eventual crisis. Having said that, the third wave may not be that severe on children. There is a particular group of children who are really at high risk, whatever the wave it might be the first, second or third. There is a group of children who have these pre-existing diseases, chronic diseases like heart disease, congenital heart disease, children with liver failure, with renal failure, or children with immunocompromised states, immunodeficiencies, malignancy, asthma, diabetes, and obesity. These type of children are definitely at highest risk when they contact the virus. And this is one of the most important aspects which we want to cover in this talk. This is regarding what we call as MIS-C. As pediatricians, and particularly as a pediatric intensivist, frankly speaking, we are not worried about the COVID infection as such, because we are confident that this COVID infection is going to be asymptomatic or very mild. But what we are really worried is what is going to happen once the wave settles down. We are going to have a huge surge of patients who come with MIS-C, that is multi-system inflammatory syndrome in children. And as the second wave started waning over June and July, by July and August, by June, July, August, we see a sudden rush in children coming with a typical features of MIS-C. What is this MIS-C? MIS-C is a multi-system involvement, means these children present with multi-organ dysfunction, and this is because of COVID, not because of the infection, but because of an abnormal immunological response to the COVID infection. This usually starts around 4 to 6 weeks after the child is exposed to a COVID infection. 90% of children who were admitted in ICUs for MIS-C are unaware that they had a COVID infection in the past. Even the parents were unaware that these children had any COVID infection. So such is the scenario. These children come with MIS-C without any history of exposure to COVID virus. This is in pathogenesis somewhat similar to Kawasaki disease, macrophage activation syndrome, or HLH. So there is an abnormal immunological reaction which happens within the body, and by which it is something like an autoimmune response where the immune system acts against its own organ systems. Is there a MIS-A, that is multi-system inflammatory syndrome in adults? Yes, even adults have the syndrome, but not as common as children. Why is this discrepancy? It's not being explained fully. the immature immunological system of the children is to be blamed here. So what do we expect in MIS-C? How do these children present with MIS-C? So they present with common symptoms. They don't have a specific new symptoms. They present with such a common symptoms like fever, diarrhea, rashes in the body. And one most important thing is they come with conjunctivitis or with oral ulcerations. And when you work up, there are certain criteria which they meet. These children obviously has fever. They might have skin involvement, plus or minus 2 organ involvement will have to be there to brand them under MIS-C. It could be renal, it could be shock, it could be hematological. One of the most dreaded complication in MIS-C in children is they have myocardial dysfunction. Most of the children who come in shock have a myocardial dysfunction. It affects the heart. But one lucky thing about this is this has a very minimal mortality and responds well to IVIG, that is immunoglobulin plus or minus steroids. So they beautifully respond to steroids or immunoglobulin to such extent that we don't have any mortality because of MIS-C. But most important aspect in MIS-C is the diagnosis. If MIS-C is diagnosed early and treated effectively, then the mortality can be brought to almost zero. So as pediatricians, our worry is more towards the post-COVID complication, that is regarding MIS-C, than the COVID itself. Apart from these MIS-C, pediatricians have a lot of other issues to face. Most important is the routine immunizations. These pandemic over a period of 2 years have deprived a lot of children from the routine immunizations. We are worried about this particular disease called COVID, but there are a lot of vaccine preventable diseases which have been there for a long time and which have been under control because of effective immunization. Due to this pandemic, lot of immunization has been left behind, and this is going to have a very serious effect in future. These children are at high risk of developing vaccine preventable diseases in future. This pandemic has deprived a lot of children from the routine immunizations. Not alone that, children who recovered from COVID are also not getting vaccinated. So I thought it would be the right forum to highlight on these 2 points. Children who have recovered completely without any medications, or children who are mild and recovered completely, can start their usual immunization 2 weeks from the recovered period. Children who were a bit sick and who required steroids for recovery, they have to wait at least 3 months to begin their vaccination. So one aspect where the MIS-C has created havoc in children is the routine immunizations. And this is another doubt which runs in a lot of minds regarding whether the virus can be transmitted from the mother to the baby through the uterus, what we call as vertical transmission. There are not enough evidence to suggest that the virus can be transmitted through the uterus to the baby. But having said that, it has been found that 10% of newborns born to COVID positive mothers were positive by RT-PCR. Mostly this is because of the transmission which happened after delivery rather than which happened during the process, that is the peripartum period. And luckily, even in newborns, in even neonates, most of them were asymptomatic. And the spread of this virus through breast milk has not been reported as yet. So regarding breastfeed, other area where there is huge amount of doubts for the expectant mother and the new mothers whether they can feed during this pandemic. So I have put certain scenarios where what could be done in patients with COVID. So as pediatricians and OGCNs, we always advise exclusive breastfeeding to all children because the benefit of breastfeeding outweighs the harm effects or ill effects of the virus. So if mother is negative, baby is negative, then obviously you are going to breastfeed. Suppose the mother is negative, but baby is positive. Okay, the mother might get the infection from the baby. So mother can start feeding using a PPE kit. Suppose the mother has recovered from infection, then we encourage breastfeeding. Even if baby is negative, obviously you're going to breastfeed. Even if baby is positive, we are going to encourage breastfeeding, even positive babies in recovered mothers. Suppose the mother is having active COVID infection and baby is negative. Again, we encourage them to breastfeed because having, as I previously mentioned, breastfeeding is essential. So even though the mother is positive, still we encourage breastfeeding after taking all necessary precautions using double masking, protective measures, sanitization, everything. If baby and mother both are positive, obviously are going to continue breastfeeding again with precaution because we don't want the mother to increase the viral load to the baby. If mother is sick to breastfeed, still we want the mother to give at least expressed breast milk. So this is to emphasize the importance of breastfeeding during the COVID wave. So apart from these normal health related issues, there are a lot of other social issues, non-COVID related issues, which is affecting children in a broader aspect. As we already mentioned about routine immunization, a lot of children are being deprived of routine immunization. A lot of children are deprived of their nutrition. Many are falling into the malnutrition category. Many downtrodden children are missing the midday meal scheme. And this COVID has resulted in haphazard antenatal care, which again is going to affect the babies in the womb. And breastfeeding, as you mentioned, has been erratic because of this COVID. Apart from this, education, lot of school dropouts. Children are missing on education. Children are being stressed. There are a lot of child abuse and child labor going on because of children losing education. A lot of obesity is coming up because of loss of physical activities, and children are not mingling with their peers, and this results in a social stress. So this COVID doesn't affect the health alone. There are a lot of other things where the pediatric population is being affected in an entirely different aspect. And this is going to take a great toll in future in these children. And the last topic regarding whether schools can reopen, I think Dr. Anup has sufficiently touched upon this topic. So I'll just go through a few points regarding schools reopening. The ideal scenario is, no, we don't want the schools to reopen until every child is immunized. That is the ideal scenario. But whether this ideal scenario will ever happen, no, this is not going to happen at all. So we don't have an ideal scenario. If you want to wait for the ideal scenario, schools can never reopen. So practical solution will be to open the schools with all the necessary precautions. So what precautions need to be taken? You have to avoid crowding. You can prefer a shift system for the children to avoid crowding in the schools and within the classrooms. One important aspect is to provide a shield around the children by vaccinating all the point of contact, right from the teachers, the bus drivers, conductors, watchmen, security, whoever is going to come in contact with these children need to be vaccinated as a priority. And within the school premises, the social distancing, masking and sanitizing has to be followed as much as possible. And there is always an option of hybrid options like both offline as online. And the reopening of school may be harmful for children, but it is more harmful for adults because these children, once infected, they carry the infection from the school to the home. So the elders at home may be at more risk than the children at the school. So it is still advisable, or the Vaccination of adults holds a very high predominance when compared to vaccination of children. So summarizing, COVID infection doesn't look at the age groups. COVID infection is similar. The incidence is similar. It infects all age groups at the same rate. Children are equally exposed as adults. Most important thing regarding children is the severity is very less. Most of them are asymptomatic or at the most very mild disease. Third wave in children, they are not the vulnerable population. The adults are still the vulnerable population. MIS-C is what we are worried about. MIS-C is a serious syndrome which might prove fatal if the number of cases is high. And the strategy still is aggressive vaccination to be undertaken by the adults if they still want to safeguard the pediatric population. And apart from COVID infection, COVID disease, children are losing a lot of other aspects like education, nutrition, immunization, and mental health. And at last, vaccination is the only safest way to achieve the herd immunity. All the best. Thank you.
Good evening, everybody. Very warm thanks. This was a very nice academic feast for everybody because everybody is scared of the third wave and the impact of third wave on the children. What impact it will make. Third wave may or may not come. Children may or may not get affected with the higher impact. But the things what we need to look is we need to have preparation. We need to get prepared for the possible third wave and the possible impact on children. So same way, even at Meenakshi Labs, we have made all the preparations regarding the dealing with this epidemic. We have RT-PCR facility at our main center. We are doing RT-PCR with real-time PCR as well as cartridge-based PCR where we can give reports within a short duration. As well as we are doing all the inflammatory markers, not only at our central laboratory, but all these facilities available at all our centers. The centers include Karaikudi, Rajapalayam, Pudukkottai is newly started. Then we have center at Kumbakonam and Mayiladuthurai. We have one more new center which has started recently at Teni. So all these centers are equipped with all the inflammatory markers, and even the samples of RT-PCR will also be collected from all these centers and will be rapidly transported to our central laboratory, and the reports will be given in the defined time period, which is very short for us. And even we are planning to expand in the next couple of months to our other areas also for the service of the patient and to deal with this epidemic. So I'm thankful for all the both the speakers. They have shared their knowledge and they have enlightened our thoughts and our all audiences. And I'm thankful for the management for organizing such a beautiful platform for sharing the knowledge during this epidemic period. And that's all from my side. Thank you. Thank you all.
Thank you.